Hello everyone and welcome to the Peninsula in Paris for a new release of our show. Welcome to you, Guillaume Dupasquier.
Hello, Jessie.
You are the CEO and co-founder of domo.health, a startup whose mission is to improve patients' quality of life, optimize health resources, and accelerate the development of new therapy through digital health.
That's right, yeah. Our approach is to combine AI and the patient at home to connect him to the local healthcare ecosystem and then to bring more efficiency in the healthcare domain.
Very interesting. So let's sit down to talk more about it.
With pleasure.
Follow me, please. Guillaume, you are a pioneer in the digital health sector. With over 12 years of experience, you bring a unique and avant-garde expertise in care technology and innovation. domo.health has created a patient-centered ecosystem integrating care and adapted technologies. Tell us, why did you want to enhance the autonomy of individuals and healthcare professionals, and for what purpose?
So, myself, I lived some difficult issues with my father. So he had a cancer at home, and then he had oxygens and home care, nurses coming at home. And then he was suffering of breath issues, he was complaining. And then suddenly he was back to the emergency section of a hospital. He nearly died at that time. And then at that time, how come then those kind of information that we could collect from home could not be brought to the doctor or to the physicians, that we can prevent that type of emergency issues. So that was the start of the company, and how information technologies could help really to avoid those situations.
It was also to address the medical deserts.
Yeah, it's the connectivity between the primary care, so the people at home, and the physicians at the hospital, which are not linked usually.
Yeah, sure. So thanks to you, now you accelerate the discovery of new therapies also. Your innovative company is in a phase of strong growth. You have quickly become a key player in the evolution of digital health. Please explain to us how your platform works.
So there is several interfaces. One is for the doctor. So he has a unique place, holistic place, where you can see all of the data, clinical data of a single patient. Those data are from electronic health record, observation from home, collected from application, mobile application, from the patient side as well as the professional side. But all of those data are collected at a central place. And then we use AI, because the doctor has no time with those flood of data. We use AI to help the doctor to look at the right information at the right time. And the USP that we have is that we have so many data that we've been collecting that the machine learning techniques that we've been developing can really help him to be really more precise in his medicine.
Yeah, sure, because you focus mainly on chronic disease, cardiovascular diseases, cancers, or such illnesses. Before launching the platform, you worked for 10 years on data collection. What exactly is your field approach?
So we are coming from the ground truth data, meaning that we are connecting the home, not only the hospital, and we are trying together with the doctor to understand which type of data they need to collect from home. So the physicians, we select a given disease like Parkinson or cancer, and then the doctor is telling us, I need to get the blood pressure or the temperature, and then we collect the data for him in a longitudinal manner, not only in photography in time, but in a longitudinal manner.
You know how to connect the dots between patients and doctors.
That is right, yes, exactly. Today the medicine is really, you go to your doctor, they give you a diagnostic, then you go back home and we have no clue what's happening at home. And in the 2 visits, then we collect those data, and when the doctor is preparing his anamnesis of the situation or consultation, he has access to this whole data.
And it's also amazing for the nurses, because the solution allows nurses to optimize their time while providing quality care.
Because there is less and less resources, in home care, more and more complex diseases to manage. So you have to focus on which are the patients who have an acute situation. And thanks to the data, then we help the nurses then to select where they should go when.
Okay. So you were selected by Microsoft in their AI program, and in 2023, an energy leader invested 8.5 million euros to accelerate the deployments of your solutions. What is your development strategy for the future exactly?
So we are continuing to collect clinical data from home. Those clinical data are used really to enhance the medicine, to be more precise, more preventive, more predictive. And then we are opening new partnership for the ones who are following our vision to be really one of the leaders in the healthcare and digital health industry.
Which is very relevant is that all health actors can be potential partners for you.
Yes, that's right. All of those actors bring a brick in this healthcare ecosystem, and everyone is part of this revolution in digital health to really be more precise in the medicine and be more preventive, and really to help to have those people staying at home longer, being more autonomous and independent.
And like that, you can adapt the platform all the time.
The more we are close to the patients and the ecosystem, the more we can adapt, because then we can learn and co-create new solutions with them.
Thank you very much, Guillaume Dupasquier, for this interview.
Great pleasure.
And see you soon, everyone, for a new release of our show.